Hey Brad, are red lights only good for stopping cars at an intersection, or are there some health benefits to this red light therapy we've been hearing about all over social media?
Well, stick around and you're going to find out.
All right.
Welcome to Talking with Docs. I'm Dr. Brad Weenan.
I'm Dr. Paul Zalzal.
Okay, red light therapy.
Also known as photobiomodulation.
Right. So what is it?
It's basically exposing parts of your body to red light.
Okay.
When red light is light in the wavelength of about, 600 to 700, 620 to 700 nanometers
Right.
of
really
light.
Small amount of meter.
Yeah. Beyond that, we're into infrared.
Right. And interestingly, in the infrared, there's like a near infrared and far infrared. They're all infrared, but the near one is just nearer to the red light.
Yeah. So infrared you cannot see, red light you can see.
Right.
So the idea is that this red light has an actual chemical effect on the cells.
Right, so it penetrates deeply through your skin and activates an enzyme, cytochrome C oxidase, and then this causes a bunch of different things. And I'd say really 4 main things that it causes.
Yeah. One, it increases your ATP production.
Right, and this is down at the level of the mitochondria, that little factory that's inside of all of our cells that makes energy. So number 1, increase ATP production. I'd say number 2 is it shown to reduce inflammation.
Right.
Reduce oxidative stress would be number 3.
And improve circulation.
And number 4 is increase blood flow and circulation.
That's
so 4, those all sound like really good things.
They sound like great things. And doesn't this biophotomodulation, it reminds me of another process in biology and civilization and existence that uses light to do something.
What is photosynthesis?
Photosynthesis, basically, now this is very different. Photosynthesis, as you know, was where you take sunlight and carbon dioxide, which we breathe out, and water, and that produces glucose, which has energy in it, and oxygen.
Sweet.
Isn't that amazing?
It really is amazing.
Tastes quite sweet. Was that a pun? Or were you
a little bit.
Yeah, it works.
Yeah.
So those are primary producers. That's where we get our energy from. Photobiomodulation is not that. Photosynthesis is a phenomenal thing.
Don't get us started about global warming.
All thanks to the chlorophyll molecule, I was going to say.
Oh.
You're a plant-based eater. You should almost be able to photosynthesize yourself.
I probably do a little bit.
But anyway, so that's another process that uses light in a different way, a much more profound way, because otherwise, without the sun, we wouldn't get these plants to make this glucose, and without glucose, we would all die.
Right. So red light, sometimes they're masks. Sometimes there are panels that you sit in front of.
Yes.
If you go to like a clinic of some sort, they may have the bigger and stronger panels. So it's a bunch of different things. It only works on the area where it's pointing. So if you put it on your wrist, it doesn't go to your elbow or your knee or somewhere else. So the site matters. The dose matters. Usually you're having a dose somewhere in the 5 to 20 minute range.
Yes.
You need to do it 3 to 4 times a week. And with respect to the dose, it is what's called a biphasic response. So too little is not enough effect, and then the middle is a sweet spot, and then too much also is negative as well.
Diminishing returns.
Diminishing returns. And also, most of the studies have shown that it takes weeks, if not months. So you have to be really consistent, like so many other things in life. Consistency really, really matters.
Okay, you mentioned evidence. Is there any evidence to support using these things? I was a bit surprised.
Me too.
When I looked at it. I thought when I first started looking for the evidence, there's not any evidence for this stuff.
So I totally agree
with you. It turns out that there is some reasonable clinical evidence that says, this might work.
Right, and that's what I think I've learned with our channel too, is that I really try to go into things with an open mind, because obviously we have biases and I've had patients say, oh yeah, put red light on me. I'm like, whatever.
But now it's like, well, wait a minute, there is a bit of evidence. Okay, let's break down where we see the evidence.
So for me, I thought the best evidence is for skin stuff. And this is where it's very aggressively marketed. To reduce fine wrinkles by improving fibroblast activity and increasing collagen thickness. So you can reduce those fine wrinkles. It's not like facelift level, but definitely I would say there's moderate evidence that this actually is beneficial. Very variable. The trouble is the quality of the device that you have in your house versus like, let's say, a plastic surgery clinic of some sort really, really varies. So you have to be careful to kind of be careful what you buy.
Even acne, I read a bit of some evidence for acne. Okay, beyond the skin, because beauty is only skin deep, that doesn't really apply, but in any case, the next one is...
You know what's nice though? Is that red light can get to that beauty.
Yeah, right? Through the skin.
Yeah.
You're right.
That's how deep it is.
That's how deep. The next one is arthritis, like arthritis of the knee. We've heard people telling us they've tried that and done that.
I really thought this was going to be no way this works.
Yeah, I thought there's no evidence for this. turns out there's a little bit of evidence that this might work as
And
well.
I think that started to make more sense as I realized kind of what it did, so that improving the circulation, getting down there, you know, and reducing the inflammation. It makes sense. If you can increase the blood flow and reduce the inflammation, which is exactly what he and I do, makes sense.
Yeah, and look, we're saying there's a little bit of evidence because there's some studies that aren't super done extremely well that kind of show maybe there is. Definitely not conclusive, but some signs that it might work. And the other thing I noticed, especially in the dermatology applications, there was some bias in some of these papers.
You mean by the people selling the stuff?
One of the articles I read, 4 of the authors were also consultants for companies that make red light devices. So you have to take that into account, right? I didn't do that deep a dive into it, just enough to see these conflicts of interest. So keep that in mind.
And so what I say is, it's an adjunct to your treatment, whether it's anti-inflammatories, physiotherapy, a brace, injections, whatever. Red light's a little extra. It's like the icing or the sprinkles on the cake. It's definitely not the cake.
It's not your go-to.
Okay. Number 3 is for like post-exercise recovery. So a lot of athletes endorse these kinds of things and use them after a performance, and that makes sense too. Reducing that inflammation, improving the circulation, getting rid of the DOMS. You know, we talk about the delayed onset muscle soreness because of things that molecules that accumulate like lactic acid. So there is some evidence for this, and works very differently than the cold plunge. So interestingly about the cold plunge, actually can reduce your performance because of the cold. You want to have the circulation. You want to bring some of those products away.
So a little bit of evidence there.
A little bit of evidence.
The next one is hair loss. Right? There is a little bit of evidence supporting that as well. Not conclusive. Obviously, it doesn't work that well, or there would be no bald people. Right. So obviously, and again, it's an adjunct to other treatments as well. Recommended. No real hair loss specialists say just do this. It's always a combination of things.
Typically with medication like minoxidil or whatever, but some improved follicular formation and reduced loss kind of thing. It sounds like more like a maintenance plan. Like Kojak is not throwing this on and coming out with big head hair.
Hair transplant
like Bob Ross.
Hair transplant surgeons are not going to lose their jobs.
No, definitely not.
Turkey and Brazil are still going to keep their GDP.
Number 5 I thought was interesting was for wounds. So wounds, like chronic wounds, difficult wounds, But again, it does make sense. Reducing the local inflammation and improving the blood supply. And we know that blood supply is probably the key factor for what allows wounds to heal. So I thought that was interesting. Beyond that, I would say,
fibromyalgia, a little bit of evidence for that. That might be some placebo, we don't know. Okay, are these things safe? Okay, I'm thinking, okay, well, if there's not guaranteed evidence of success with these devices, are they safe enough that the risk-benefit ratio, given the fact that the benefit's not going to be that great yet, are the risks outweighing that?
So I'd say the main medical risk I'd say is to your eyes. So infrared light you can't actually see, so you wouldn't squint, you wouldn't close your eyes in response to this, so it could do damage to the inner portions of your eye. So definitely if you're putting it on your face, you're looking directly at this light, you should be wearing glasses of some sort, and often they come with little protective lenses. I would say the second thing is make sure you use it as directed, so if it says 10 minutes, don't use it for 3 hours. And then I'd say the big risk for me is financial.
It's going to cost you some money. For me, the thing that really I found to be quite a conundrum was, well, red light exists in the spectrum of sunlight. Okay? Just as much, if not more, if you go out in the sun. So can't you just go out in the sun and get the same effect? Okay, there's some drawbacks. You've got the UV that can cause skin cancer, affect the DNA, so put on some sunscreen. That's not going to block the red light. You're still going to get red light going out in the sun. I tried looking into that, and I couldn't find a real reason why sunlight is not going to provide the same amount of red light in addition to others. Unless the other frequencies or the other wavelengths of light turn off that signaling that the red light
Almost
does.
like they talk about like whether the waves are in sync kind of thing. It's hard to know.
I don't know, but I figured, well, just go in the sun. You're going to get your red light there. There was a conclusion in a paper that I read that really summed up the way I felt.
Here we go.
If I may.
If I may.
So it said, there appeared to be some benefit for some health conditions, right? However, given the overall low to moderate certainty of evidence for most endpoints, so most of the things they're trying to do with it, further high-quality trials and standardization of photobiomodulation protocols are warranted before widespread clinical adoption.
So
that's the way I feel.
We got a hard maybe. Might work. Hard might work.
We need to study it more to figure out if it's going to work.
And I think the trouble with all these studies is they're so different. Protocols are different, devices are different, like strengths are different, like diseases are different.
And the bias, these are often funded by the companies that make these things, or the authors are on contract with the companies that make these things. So you have to be really careful if you're reading a paper about this stuff. So at the end of the day, would you try it or use it for any, after you work out, would you go and hop into the red light?
Probably not, to be honest with you. I'm busy. I could there's too much stuff. Sorry, I see in 20 minutes, I gotta go stand in front of the red light. I guess maybe if I was a professional athlete or something, or I don't know, if I had a lot of knee pain, maybe. I was trying to avoid surgery, who knows?
I've never recommended it to a patient.
No, me either.
Would you, maybe now I will. At this point, say, hey, why don't you try this if you've tried everything else and you don't want surgery?
Like, why? You think I got wrinkles?
Yeah, no. I think it might work. I don't think it'll work, but you might.
There you go.
I don't think it'll work, but there's a 30% placebo effect.
There you go. If you like this video, please like it, subscribe to our channel, share it with someone who's got like a big right and telling you how great it is.
And remember, you are in charge of your own health.
We'll see you next time.